What do benign and malignant findings mean in a colon pathology report? Imagine sitting in your doctor's office, waiting to hear what your colon tissue sample reveals. The results can seem confusing, but understanding the basics can help you grasp what your report means. When your tissue is examined under a microscope, the pathologist looks for signs of abnormal growths or cells. These findings are categorized as either benign or malignant, and each has important implications for your health. Benign findings in a colon pathology report mean that the tissue or growth does not contain cancer cells. These are generally not harmful on their own. Common benign growths include hyperplastic polyps and inflammatory polyps. These types usually do not turn into cancer and often requiring no treatment. Another benign finding is an adenoma, also called an adenomatous polyp. While adenomas are benign tumors, they are considered precancerous because they have the potential to develop into colon cancer if left untreated. That's why doctors often recommend removing these polyps and monitoring for future growths. The presence of adenomas signals a need for closer surveillance, as they can be markers of increased risk for colorectal cancer over time. On the other hand, malignant findings mean that cancer cells are present in the tissue sample. In the colon, the most common type of cancer is adenocarcinoma, which originates from the glandular cells lining the colon. When a report indicates malignancy, it confirms that invasive cancer has been found. This means the abnormal cells are growing uncontrollably and may have the ability to spread beyond the colon to other parts of the body. The pathology report will often include details about the type of tumor, how abnormal the cells look, and how quickly they are growing. It will also describe whether the cancer has invaded nearby tissues, involved lymph nodes, or if the edges of the removed tissue are free of cancer cells. These details help doctors determine the stage of the cancer and plan the best course of treatment. Additional information in the report may include microscopic descriptions of the tissue, whether the edges of the removed tissue are clear of cancer, and tests for genetic markers. These markers can influence prognosis and help guide targeted therapies. For example, tests for microsatellite instability or mismatch, repair gene status can provide insights into how the cancer might behave and respond to treatment. In summary, if your pathology report shows benign findings, it usually indicates non-cancerous tissue that might need removal or monitoring, depending on the type. Malignant findings confirm the presence of cancer, which requires further clinical management. Understanding these terms helps you better grasp your health status and the importance of follow-up care. Always remember to discuss your results with your healthcare provider, who can interpret them in the context of your overall health and guide you through the next steps.